right here. Angela's going first. She'll announce me. I will announce you. Right? You're Jennifer. You will announce is it Modest? Or Corey?
Anyone else needs a copy of the release?
I got
X-N-E-R. You can write it phonetic if you want. O-X-N-E-R.
I have Biketti, so I know all what you're talking about.
Sometimes easier.
You're right.
It's just like ox.
You're comfortable taking off
yes.
your mask when you talk, and then you can put it back on when you sit back.
Good morning. My name is Angela Biketti. I'm a nurse at Alina's Abbott Northwestern Hospital, and I'm proud to serve on the board of the Minnesota Nurses Association. Yesterday, Minnesota nurses in the Twin Cities, Twin Ports, and 2 harbors voted overwhelmingly to authorize an unfair labor practice strike. We don't want to be out on that sidewalk. We want to be at the bedside caring for our patients. But the conditions our executives have created in our hospitals are unsustainable for our nurses, but most importantly, for our patients. Patients are waiting for hours and hours for a hospital bed. Nurses are leaving the profession in droves. This is what we've been fighting to fix for nearly 9 months in our contract negotiations. But our hospital CEOs with million-dollar salaries insist there is nothing more they can do. We refuse to accept the new normal in our hospitals. Nurses deserve better. Patients deserve better. That is why we are announcing today our intent to strike at 17 hospitals throughout the state. If an agreement cannot be reached, nurses plan to begin their unfair labor practice strike on December 11th at 7 a.m. Nurses in the Twin Cities and Essentia plan to strike through 7 a.m. on Saturday, December 31st, 2022. While nurses at St. Luke's in Duluth and at Lakeview in 2 Harbors have chosen to strike with no end date in sight. Let me say again, we don't want to be out on that sidewalks. That decision now rests with our hospital executives. They can come back to the bargaining table and agree to fair contracts for nurses to solve the crisis of understaffing, care, and retention in our hospitals. We want to reach an agreement at the bargaining table to keep our nurses at the bedside and protect patient care. We are ready to do everything we can to reach an agreement to put patients before profits in our hospitals. I would like to now introduce Tricia Oxner from Children's Minneapolis.
Thanks, Angela. Hi, I'm Tricia Oxner. I'm a registered nurse from Children's Hospital, Minneapolis. I've been employed there for 30 years, which just might qualify me as an expert. The staffing crisis has been dire, as we have been sharing for months. There is no end in sight, and things have only become worse. Like other pediatric hospitals across the country, Children's experienced an early RSV surge, which has resulted in longer than usual wait times in the emergency departments. Sometimes families are waiting for hours and days to be admitted to a room, while they're slumped over chairs, laying on floors, and sleeping in their parents' arms as they line the hallways. The hospital is at capacity and is maxed out. We have reached our limits. This is a hardship for patients and families in our community, and it's an ongoing strain on nurses who have been understaffed for over 2 years. Our platform has not changed over the past 9 months that we have been negotiating for a fair contract. We will continue to stand up and fight for safe staffing. We will continue to stand up and fight for a fair contract. We will continue to stand up and fight to protect our profession that we care passionately about. We have gratitude for the nurses that came before us to blaze this trail, and we will stand strong for the next generations of nurses that come after us. I ask, why do they, leadership, get to remain nameless in an office or working from home or on a golf course while we keep coming back day after day to the same horrific staffing? At the negotiation table, their answers remain unchanged. They do not want nurses involved in the decision-making process, yet their decisions are leading to the decline and failure of a system. A colleague shared her feelings yesterday with me, and she said, as I drove to the hospital on my day off to cast my vote, I felt like it was a chance for me to express my voice, my feelings in this time of horrific staffing. As a nurse, she worries about whether she can provide the care for loved ones and family members that deserve it. We do not want to have to take this step. We want to settle a fair contract at the negotiation table, but the future of the nursing profession matters. We will fight for what we know is right, because that is what a real kid expert does. Thank you. I would like to introduce Jennifer Martinson. She's from North Memorial.
Good morning. My name is Jen Martinson. I'm a nurse at North Memorial, and I've been there for 5 years. I became a nurse, like most of us, to help and care for people. North Memorial prides itself on being an inclusive health family. This could not feel further from reality. I was pregnant for the first time and working at the bedside during the early days of the 2020 pandemic. In 2021, my daughter was often catching viruses at daycare and bringing them home. As her primary caregiver, I often got sick too and would be required to prove that I did not have COVID in order to return to work. I made every attempt to ensure that I was not exposing my patients and my coworkers, but it did not feel like North Memorial management made this a priority. Is this how you treat your family? Ask any nurse with young children how much paid sick time they have in their balance, and they'll probably tell you, not enough. In the last month, I have gone without pay due to calling in ill and not having adequate sick time. We have asked North Memorial for increases to our sick time accrual and have not received a response. Nurses with young children are asking themselves if it's even worth working outside of the home. Is this how you treat your family? Over the past few years since the pandemic began, we have felt abandoned at the bedside. We are asking for changes that would help our nurses feel valued and keep them working in the hospitals where they are so badly needed. Where has North Memorial leadership been? Rather than coming to the bargaining table to create solutions to the issues we have raised, our employers are committing unfair labor practices time and time again. After repeated attempts by the union and our nurses to create urgency, North Memorial leadership has forced our hand to call a strike. If we do not do this now, we will lose more nurses, which will threaten patient care in Minnesota. North Memorial nurses have been pushed to their breaking point, and North Memorial leadership will find out what nurses are capable of. Next, I'd like to welcome Modest Akuri from Health East.
Yeah, good morning, everybody. My name is Modest Okore. I represent the old Health East, which is St. John's and Bethesda Hospital. For so many months, we've been on the negotiating table, trying to better the lives of nurses and also trying to better our staffing, our grid, in order to be able to take care of patients. But I tell you right here that for the past almost 9 months, nothing has changed, in our negotiation. So management comes up thinking that, they have what it takes to make a deal. And when you look at it, you say, what is this? Mainly we are asking for, good staffing, to have a say in the grid. Even, just to say that when you are 51% of nurses know that things are not going right, you have a lot of false sentinel events, increase in infiltration and everything, that we want to say that the grid is not right. And you don't need a rocket scientist to tell you that something is wrong when patients are falling regularly, which means the nurses don't have eyes on them. You don't need a rocket scientist to tell you that. But they say no. We have, over the past years, nurses have covered the lives of our leaders. Just imagine a patient sitting in poop, putting on her call light or his call light, and you can't get to that patient for over 30 minutes, an hour. What do? We go in there to apologize and lie to them that it's because we are busy with other patients. No, that wasn't the case. The case was that because we are not well staffed. We've been covering the lives of these managers, but I think it's about time the public knows that the reason why your person, your family member, is not getting the appropriate care they're getting is because we don't have the staffing to take care of that. A lot of our members have left the nursing profession. When I say leaving, that doesn't mean that they left and went to another hospital. No, they are tired. We are tired. Security has not improved. So if you go to St. John's emergency department, you see people in the hallway. They are using now hallway as a ward, a room for patients. If somebody wants to have a BM or be impressed, they screen around. Imagine you or a family member. I just want people to think through it. We don't want to go out there in the cold. And again, for them making an excuse that, we just want to use the opportunity of, the influx of all these respiratory, that is absolutely wrong. It's just propaganda. Because this season, every hospital, everybody knows that all these infections comes up. If you don't want that to happen, they could have settled the deal even before the first strike. So when you see or hear the hospital talking about, we are opportunistic because of this, particular season, it is a propaganda. And that pains me in particular a lot. So we want them to settle. We don't want to go out to the cold. And again, if you love your staff, you wouldn't want them to go out to the cold, the freezing cold. So they still have the opportunity to get things right. And we'd like to be at the bedside for our patients. We don't want to let them be there taking care of people who don't know them. We feel happy, smile each day we come to work and see the patient expecting us to be there. Just quick info here. When we return from the last strike, and I know what is happening at my hospital happens to the other hospitals, you will see the brightness of the patient face, seeing us coming back. So that's why we are authorizing a strike. We are going for a strike, as we said, moving out on the 11th. And they have what it takes to prevent that from happening. Next, I will introduce Zoe Omri from Methodist Hospital.
Thank you. Good morning, everyone. My name is Zoe Omri, and I've been working at Methodist Hospital for 15 years. 14 of those 15 years has been on the ICU. And Methodist Hospital carried the slogan, "We make good happen." My question to them, what good are you making to happen right now? And I work as a bedside RN and a charge nurse and a preceptor. I haven't seen staffing crisis as horrifying and terrifying as it is now. Every time I decide to go to work, I'm afraid, what am I going to meet? What's going to happen today? If my patient's going to stay alive, am I going to be a mother, a babysitter for other nurses who do not really know what's going on? Those are the questions I ask. We are hemorrhaging and bleeding our nurses like a patient bleeding to death without intervention. Every night you have to struggle to make assignments because there aren't enough nurses. We barely have experienced nurses, and our patients are at risk. I have to always be on the lookout for patients and to help newer nurses to do the right thing. I'm just going to take a quote from Dr. Martin Luther King that says that, he says, we have come to the Capitol to cash our check that the federal government has given us. Today, to the hospital executive, we have come for you to cash that check. You keep saying we have no issues with granting vacations, we have no issues with staffing, we have no issues with skill set to take care of our patients, just to name a few. Nurses are ready to strike if necessary to send a message to the hospital, and that was said clearly last night, that our patients matter, giving efficient and proficient care also matters, and it is a time, again, to cash the check, to make good happen. It feels like for them, patients are just like numbers. For us nurses who see them at the bedside on a daily basis, they are human and individuals who matters. So make good happen, Methodist Hospital. Make good happen for our nurses. Make good happen for our patients. So don't put profit over patient. Thank you.
Questions?
Angela, if I could
Yes.
ask about the timing of this?
Yes.
If you call the strike, if you announce the strike vote results and give it time, that creates some motivation to negotiate. But if you issue the strike notice right away, now hospitals have to start planning for the strike. Why call the strike notice? Why call the strike so quickly after the vote?
Oh, sorry. Because it's time. 9 months after the table, we have gotten nowhere on staffing. Our hospitals, my hospital included, said they're not interested, or our proposals don't retain our nurses. Every hospital behind me has brought proposals to retain their staff. But every day when our hospital executives understaff our units, that's not our fault. We're here to advocate for them. We're here to protect our patients. They can avoid this strike completely. Our hospital, our nurses have made it very clear. Staffing is a huge priority. You heard all the stories today. They refuse to be collaborative with us, but we're going to be out there protecting our patients. But if on that day, staffing and other important issues is retaining our nurses, healthcare is at a huge jeopardy in the state. So they need to come to the table. They can be collaborative. It's very easy. I've sat across the line of health numerous times negotiations, but every year staffing is an issue. Time is up. You need to put staffing on the table. You need to protect our nurses, but ultimately we're here to protect our patients. That's it.
What have you agreed on?
So the hospitals have various agreements that they've agreed to. I can tell you at Allina Health, it took our nurses being shot at to get an agreement on workplace violence. I shouldn't have to do that. I shouldn't have to go to these nurses when they were shot at, and no management came to discuss them in person to make sure they were okay. I finally got an agreement on behalf of the nurses on workplace violence. That's unacceptable. Other various hospitals have various agreements at their local levels, but I can tell you staffing is still a deal breaker. That's an ultimate deal breaker for these nurses behind me and all 15,000 across the state. Yes. Yeah. Our nurses were shot at, and not one leadership came in person from home while they were sleeping to check on them. They forced them to stay while they were hugely traumatized by what occurred. And then we finally got an agreement at the table. That was only because these nurses came to that table, packed that room, and said enough is enough. You need to protect us. Yeah.
What was the agreement on patient injuries after that?
What was that?
What was the agreement on nurse injuries or workplace injuries after that?
At Allina Health, we wanted that notification system. We wanted protection at that bedside. We wanted metal detectors, and that was even difficult to even ask for that because we shouldn't have to do any of that. Our employers should protect us. Enough is enough. Violence is increasing in the healthcare field. Nurses are leaving because of it. Injuries occur every day. So we did get an agreement, but that was only after being injured at Abbott Northwestern, for example. Yes. More questions?
Any thoughts on, we're dealing with flu, RSV, still have COVID out there. They're already stretched thin. You want to do this for the patients, but do you have some, how do you score that?
You know, I think the nurse behind me made a good point. These influenza, the RSV, happens every season. The hospitals know that. But now after the pandemic, we are stretched even thinner. But that is why staffing is so crucial to obtain in this campaign. We don't want to be out there. I don't want to be out there after being out with Alina. I don't want to go out there, but I will for my patients. Enough is enough. Our management bullies and threatens our nurses when they try to advocate for our patients every day. It happens every day in every hospital behind me. We shouldn't be bullied. We shouldn't be threatened. We want to advocate for it. That's unacceptable. So granted, your illnesses are up, but we're here to protect that and get an agreement, and they can avoid it before that day.
Can you speak to what this will mean for the nurses here in Minnesota for that 3-week period over the holidays to be without work, to be without pay? What does that mean for them and their families?
I think that's a great question. And I can tell you from experience, it is rewarding to have those patients come out to us while we're on that strike line and to say, we're behind you. We stand behind you. I've never seen nurses come together more than we are on that picket line because we know we are fighting for a good cause. We know our patients know that, and that's the most important for us. And our nurses will band together. They'll get through this. But ultimately, they know the end goal is to protect our patients. Our hospital should be putting patients before profits. That's our slogan. And I think our nurses are willing, they're ready to stand behind it. But we don't want to be out there. But if staffing is not in that end agreement and other various things at these hospitals, you won't have an agreement between the nurses and the hospital executives.
What is the specific language you're asking for when it comes to staffing?
Yeah, that's a good question. So there's a lot of various formats to it. A lot of hospitals have said they're not interested. They're not willing to counter on it. Ultimately, it's more resources. We want that collaborative effort with all the hospital executives to get more help on the floor. Also, our EDs are overflowed. People like you heard today, they're sitting in the hallways, they're sitting in the waiting rooms, waiting hours, up to 8-10 hours for a bed, even to be seen. That they need more help in the ED. They need that influx. If you fix staffing, you will help retain your nurses in the workforce. Yes.
Which tables have agreed to mediation, and has that process started yet? The mediator
Some of the tables have agreed to mediation. I think Sam would be able to better understand. I know there is a couple. I can speak. It isn't always, a lot of your teams will look at mediation when it's get closer to a deal. They'll take that into consideration. But mediation ain't going to help when your hospital executives have continued to say they're not interested. So they're going to be just as frustrated as we are. We are frustrated. But having a mediator in a room isn't going to force the employer to come to agreement. They should talk to us. We're collaborative. We know our bedside and our nursing better than anyone. Come talk to us. We're willing to talk and discuss a collaborative effort on staffing. Yes?
Other questions? Angie, some of these problems sound a lot bigger than just a contract, and I imagine they're going to continue even if you got everything you wanted. So, I mean, how much of this can be resolved right here with a deal? Because I don't want to leave patients on to thinking everything will be solved.
Yeah, I wish everything would be resolved. Ultimately, healthcare is changing day to day. And these nurses shouldn't have to put in their contract to provide safe staffing. I shouldn't have to do it. These nurses, the 15,000, shouldn't have to advocate for it. Staffing will change. Our patients change. They get sicker and sicker. So will stuff need to be changed? Yes. But to make that starting point will show that your hospital executives actually care. Put it in the contract shows that they actually care about their patients. And I think that's important. That is why we're asking for it to be in our collective bargaining agreements to show enough is enough. Yes.
Sorry if you've answered this already.
Yes.
Does it appear that some hospitals may be closer than other hospitals in agreements, or is it uniform-wide and close? You know what I'm saying?
I think it all depends on the hospital and the bargaining unit the nurses represent. Ultimately, the biggest issues on staffing is still not decided and resolved. Come to any agreement at the hospitals. And I think regardless of any other tentative agreements or anything like that. That to me is the deal breaker, and also to retain our nurses. So some might have different agreements. I can tell you at Abbott Northwestern and Allina Health, and a lot of the units behind me, staffing needs to be addressed. And without that, we are nowhere close to getting that tentative agreement to avoid that strike. Yes.
How confident should people be that when they go to the hospital, they're going to be receiving quality care over the next several weeks? Just because hearing from this, it would maybe deter some people from being confident in their health care.
Over the next what days?
Next several weeks.
You know, that's a great question. You know, we gave them that 10-day notice. They have that legal amount of time to prepare. But any nurse that comes in from an outside place does not have the experience. They don't know the protocol. They don't know the nursing, as me or these nurses behind me are all 15,000. That's a safety issue. They can avoid it. They're paying those nurses an obscene amount of money when all we want is staffing. Put that money that you are paying those nurses to work during a strike into staffing, and you won't be having that strike. Your patients will be cared for top-notch, but ultimately these nurses are making that sacrifice, going out there on that street to push patient safety, and our patients understand that. Yes.
Any other questions? Great, thank you.
Thank you.